So I wanted to bring up the topic of PDA today, pathological demand avoidance. On social media, you see a lot of divide between older generation and the younger generation, whether PDA is more about laziness and if you should just push through it, or if it's a real thing.
We should also talk about the fact that PDA is actually panic response and not defiance, and about the importance of roleplay in the context of people living with PDA. I'm Dr. Tom, psychiatrist, specialist in neurodiversity. I'm a neurodiversity advocate, and this channel has a clear, unapologetic stance in defense of neurodiverse people. No BS, no virtue signaling, just solid, honest content grounded in science, lived experience, and real-world relevance. If you're tired of cliches and want strong, actionable ideas that challenge stigma, clarify concepts, and empower neurodivergent individuals and allies alike, you are in the right place. I want to start off describing what PDA is. So there is this acronym, and there is actually two different forms of reading the acronym. One that's more commonplace, but probably less good of a description, is pathological demand avoidance. And we like to rephrase this nowadays as pervasive demand for autonomy, because we truly believe that pervasive demand for autonomy describes PDA better than avoidance of demand. So you know how many PDAs are actually misdiagnosed in early childhood as ODD, ODD being the oppositional defiant disorder. And to many, that's kind of a child and adolescent version of ASPD, which is antisocial personality disorder. So those would be the future delinquents or substance abuse disorder patients, which is also a misconception, but more on that later. ODD, oppositional defiant disorder, as the name very well describes, is something that's very strongly grounded in opposition for opposition's sake. It's grounded in defiance for the sake of defiance. This is not at all what happens in PDA. In PDA, the person that lives with PDA goes through a panic response, very much along the lines of fight, flight, freeze. Much of PDA might just be interpreted as freeze. The freeze response, by the way, you probably know this, but freeze response much better socially, globally, and personally for the person that experiences it. The freeze response is much better than the fight response, and the fight response is the worst of the three. So if you could go through the freeze response, that's the best of the three. The flight is the second best, and the fight is most likely the worst of the usual stress response reactions. So what happens? So just to talk about this a bit more in a neurological sense. So when you think about ODD, about opposition and defiance for opposition and defiance's sake, you're in control. You are showing that you're capable of opposing and defying the order of the authority or of your peers that's been given. And you're doing this through your frontal lobe. You're doing this conscientiously. You know what you're doing, and you're not responding in a panicky, anxious mode. You're doing this on purpose. And obviously for whatever reinforcement there be, and also there's a genetic side to it, but let's not elongate too much on ODD. But in PDA, it's really, really important feature is that it's an amygdalian response. So that's the reptile brain. That's the very most primitive part of the brain that basically all the animals share. Reptilians, mammals, whatsoever. This is the basic response that if you see a tiger, let's say in Baltimore, you have to understand whether or not that tiger is real. But before you do that, through your frontal lobe, you start running because you don't have time to react. And if you don't choose to start running, then maybe you want to choose to fight the tiger because you kind of feel like that's an
option.
Smallish tiger, like cartoony tiger, where it's called Cheetos, Lay's or whatever tiger. You feel like, okay, I'm gonna whip this fucking ass. But, well, you can do that. And the third option is to freeze and fake you're dead and your meat is actually spoiled. And if the tiger's gonna eat you, he's gonna have a bad time and 2 weeks of diarrhea. And that's precisely what PDA does. The last one, the freeze response, is very, very primitive in the sense of it's existed for millions of years. All the animals have this. And there's a very Darwinistic, a very evolutionary side to this. That since it's preserved in all the animals, it's very, very important response. We have to understand it. It's an important response. People with PDA that show defiance or opposition, they're not doing this for defiance. It's not real opposition. They're just clinging, struggling so hard to cling on to that bit of control that they still perceive. So what happens is there might be some demand, and that might be fun, but that walk in the park might not be a piece of cake to that person. So even if you're apparently not putting any demand or any pressure on that person might still interpret or perceive your demand as a pressure. And let's go. Sorry to just keep going here, but this is really important. But the fact that sometimes you could even just praise a person that lives with PDA, and that praise now becomes a demand because it's implicitly understood that you're asking this person to keep on being perfect forever. So that person will intuitively avoid hanging out with you, will avoid responding to your requests, will ghost you, but much different from what people perceive it to be as a defiant or challenging authority in school or whatever. It is really at its heart a panic response that's very, very close to the concept of ASD, autism spectrum disorder, overall. Other neurodiversities, we don't know yet for sure if it's a thing on its own, but usually people associate it with autism.
Okay. It's interesting you brought up praising being putting pressure on someone. And I think that's a very key distinguishable feature. People often portray on even social media or when talking about PDA is like, if it's do washing dishes. That's the common example that people talk about. You could be washing dishes and no one asked you to do it. You're just going along, doing your chores. But if someone walks by and says, "Oh, thank you for doing the dishes," that does trigger a response with PDA. And it's a response that internally I've had to fight. And I know other people that show PDA, not just as being, "Oh, I'm just not going to do what you asked me to do." It's not that. It's people that are being praised for doing something instantly shut down. I no longer want to do that thing. And it's not because I don't want to finish the task. It's not because the task doesn't need to be done, or that I'm going to purposely not do it because screw you kind of thing. But if you praise that person, there's something that just like shutting down is the best, I think, phrase that I can give for it. It's your brain, your energy, your desire, everything turns off, and you're just kind of left like, crap. I was totally fine doing this task. I could have completed it. If no one talked to me, if no one said a thing, I'd be done. But because someone took the effort to talk about it, whether being a demand or a praise or any form, their acknowledgement of you doing that task triggered that shut off.
100%. There's a good spectrum. I feel like when you're saying that you've experienced some PDA, that's probably true because it's a spectrum as well. It's not like you do 100% or 0%. Well, you could be anywhere along the line of the spectrum. But that's exactly it. So what PDAers often relate to is that if you have a hobby and you're enjoying yourself and you're a good reader, or you started playing piano, and you get some kind of praise or some kind of implicit expectation, you immediately shut off and you do not want to do that hobby anymore ever again.
So it's not just tasks that are energy using, it could be pleasurable things as well.
Yeah, the deal, the issue, the hinge for PDA is the anxiety that's associated with the statement that's been made or that's perceived by you. So the judgment or the expectations, the structure that's insecure, that's what it all hinges on. So if someone tells you, wow, you're such a good reader, hey, great at golf, or hey, you really good at learning Spanish, whatever, that's people will probably not perceive what they're doing, but they are putting a load on you, obviously meaning well and whatnot, but still the anxiety response will make you shut down and freeze.
So it's how the person receiving the praise perceives the praise. Some people can perceive the praise as great, thank you, move on with the day. Some people can perceive it as, oh, now you expect more from me, or you expect maybe a continuation of this habit.
Exactly. So in ODD, the oppositional defiant disorder, that's not true at all. There's no anxiety response whatsoever. It's just opposition for the sake of opposition. And even though on the surface both behaviors might seem subversive or defiant, the PDA response is obviously not defiant or challenging authority whatsoever. But the misdiagnosis is really still very popular, and often ODD patients might get diagnosed as ASDP, PD, antisocial personality disorder patients later, and then they're kind of starting off life at a disadvantage because of that diagnosis. That's also really stigmatized, which is also a misconception, but still. And but many medical service providers, many therapists aren't aware of PDA, and it's still a coming and modern concept. And either that happens, and the provider isn't aware of what PDA is and how it works, or about what ASD is and how ASD works, or the PDA or the ASD person is really good at masking, and then that ends up obscuring the true reason for that behavior. So it might be easier for anxiety-driven PDA to even buy into the narrative of saying, yeah, no, I'm doing this because I like to cause trouble. I like to be defiant, because now that also gives him a sense of control, because now he has a narrative. And we'll talk about roleplay later, but this will also be part of the roleplay. Yeah, no, because I'm a super villain. That's exciting. So, and that gives you a sense of control. So we oftentimes end up pushing ODD and ASPD on people that aren't really ODD or ASPD. So if you were to have that diagnosis at any point, it'd be really interesting to understand whether or not the provider considered that you might have also been autistic or neurodiverse or PDA. That's really important actually for any of the disorders listed in the DSM. You as a provider are supposed to rule out neurodevelopmental disorders such as ASD and PDA, which is not in the DSM yet. The DSM is a diagnostic and statistical manual. That's the basis for psychiatric diagnosis all over the planet, basically.
So you're saying PDA is not in the DSM,
right?
But ODD and ASPD are.
Yes.
Okay. So do you think that is why a lot of people go that route when kids are younger, because they're going, here's the manual, I'm going to stick with this, not look outside of it?
100%. But you could, if you're That's definitely a really obvious bias. But if you're doing really good practice, you could easily see how PDA behavior fits into the ASD spectrum. You just have to understand how it happens and why it happens.
You mentioned masking and role playing a few times there. Now, masking, covering up how you feel, how you react to things to kind of fit in more. A lot of times on social media, when you see videos about PDA or you see discussions about it, you see an older generation kind of do the, power through it move. Would you say that powering through and kind of pushing through for someone with PDA is a form of masking?
So that's not an easy answer here, but yes, basically yes, but I'll have to elaborate a bit. So yes, masking is pushing through is masking, and but as an ASD, neurodiversity, or PDAer, you should ideally be capable of choosing whether or not you want to mask. So there is this really strong neurodiversity advocacy for saying you should never be obliged to mask. And I do believe that that's a really, really good statement, and it's definitely true. In an utopian world, in the perfect world, you should not mask. That's obvious. You should basically never mask. Maybe there's an exception here, but I'll talk about this really quickly. But in a utopian world, you should basically never mask. But since we're not in a utopian world, you have to choose your battles. You should know where to mask, and ideally, but you should never teach someone to mask without that clear consent to understand that you're just doing this because the world is not right, not because you are not right. But if you're talking to a boomer and an older generation, those generations are usually not as neurodiversity affirmative. So they will probably never even have dealt with someone that's a declared ASD patient. They're neurodiverse in any way. They don't even believe ADHD is real sometimes. So it's really hard for the older generations to understand that those things are real. And by saying that, I'm also saying that for these generations, it's harder to understand that people might be entitled not to mask. That's, like when we talk about misconceptions about neurodiversity, it's like the idea that neurodiverse people have to try really hard to seem neurotypical. I totally hate that, but it's gonna take you a while to, let's say you have a 70-year-old judge that's judging your parking ticket. If you're not masking there, you might get fucked up just because you're being yourself.
Sure. A lot of people will have notions about people by the way they act, right? So talk about like queer people, if we act a little bit differently, we stand out and therefore we're more likely to face consequences. So by not masking, you're not fitting into the box that people would expect, and you might face extra consequences because of it, from older generations at least.
Let me talk about the exception to masking. So maybe even in a utopian world, the perfect place, maybe masking still is adequate in interpersonal relationships. So let's say you are using a really ugly outfit and I hate it. I hate everything about it. And you ask me whether or not I like your outfit. I'm not 100% sure that in a utopian world it would be adequate for me to say that I hate it and that you should go change and whatever. Obviously, we might have a different kind of relationship, like a ball busting guy's friendship, whatever.
Sure.
Then that might be adequate, but you might not even take me seriously either way. So,
right.
But still, there are some exceptions to the rule. And this is probably easily seen if we understand that we all mask. It doesn't really matter whether or not you're neurodiverse and neurotypical, but we all mask in different moments, in different situations of our life. And that kind of ties into the role playing that's also very much associated with PDA. And that's also a misconception, a false belief that people hold against PDAers. But I want to start out just first talking a bit about how neurotypicals also role play all the time. So in the specific example I just gave you about hating your outfit, I'm role-playing a person that's gentle and comforting. I might not want to do that, but I am. I know it's adequate socially. I'm engaging in role-play because I know it makes sense, and I'm role-playing as well when I hold the door open for someone, when I hold the elevator, when I let another driver yield at a busy intersection. I'm being a gentleman. I'm being
Yeah, things that we perceive as politeness.
right. I might also roleplay being a nice husband tonight at night. I might roleplay being a good father. That does also not mean that I'm not a gentleman, a good husband, or a good father, whatever. We still engage in those roles all the time, and those roles are usually complementary in the sense of there is no slave without a master, and there is no master without a slave. The fact that those are complementary is what we usually call dynamics, right? The relationship dynamics. And these kind of relationship dynamics is also something that's really hard for PDAers to deal with, specifically because of the fact that those relationship dynamics are very, very profound and very weird social coding, and then it depends on the situation, and you might want to make fun of your friend while playing Xbox, but you probably will defend him if he gets into a fight with someone else. So there's really very hard reading those kind of situations, and those are really usually kind of unstructured and not predictable at all. This is probably a really important buzzword here for PDA, the fact that you're being predictable, that beats being nice every time. It's much more important for you if you're living with PDA, someone with PDA. If you're being predictable, you're giving them much more of a structure, much more of a scaffolding for that person to use to make their informed choices. And let me tie this now into how we, anyone, neurotypical being neurodiverse, role play all the time is probably pretty obvious in a specific section of our life, that's sex.
Okay.
So you're probably aware of the fact that about 60 to 70% of the world's population is into some kind of complementary dominance / submissiveness role play. That might be full-on BDSM, but that also might be just teacher and student, or that also might just be nurse and patient, whatever. All of these are authority-inducing, and this is a really common role play. Basically, everyone does, and the ones that the 20 to 30% that don't respond to that probably still do it or don't realize they're doing it on a different level. So when we do the surveys, people usually take this more as a, do you do full-on BDSM? Do you like pain? Do you like blood? But that's not at all the question. If you could just like approach this again as, would you like to be a police officer? And
sure. Or maybe even just lowering the threshold a little bit, being maybe a little bit more aggressive or less aggressive than you are in your day-to-day. Because that's the point, right? You're taking on a role of someone else or a different personality. So in comparison to your day-to-day life, are you a little bit different when it comes to sexual activities?
So you know what, for how social abilities, social training, we usually recommend people do structured activities, and like structured dates are much easier than unstructured dates. So if you could go on a date, like watching a movie as a first date is much less anxiety inducing than having to be one-on-one with that special someone that you are crazy in love about at a dinner table, and having to depend entirely on you're not panicking and on you're not freezing, on you're not PDAing out yourself out of this kind of situation. So if you have a structure that takes the edge off for anyone, you don't really have to have PDA. But in case you've wondered why so many PDAers do prefer the submissive sexual role play, it might sound counterintuitive, but it's actually makes a lot of sense, because the PDA will hand over the guidance to the sexual partner. but will still maintain control because of how predictable and how structured the whole situation is. So the nurse and the patient, the student and the teacher, the dom and the sub, all of those are really predictable and structured and really obvious. So even though it might seem like the PDAer is counterintuitively giving over control, he's really not.
You also, in a lot of these scenarios, a lot of people set up guidelines or rules ahead of time.
Safe words.
So even if you're giving up control, you're giving up control within boundaries.
Right. And now you're giving up control within boundaries, and you don't have to direct the relationship anymore. It's now your partner's turn to make sure all the next steps are clearly stated. You don't have to worry about anything anymore. It's basically having sex by watching a movie and not having to depend on your ability of being an actor. If you're a PDA and you haven't thought about this yet, you should probably give it some consideration, because it really gives you a really clear structure. There's no expectations that are tacit or obscure. Everything is voiced. You will have really clear instructions, and it's really, there might even be a setup where you're not even capable of talking. Sure, make sure if you're doing that, you have some kind of way to communicate your safe word.
Right.
But still, it's pretty obvious how that takes the edge off for neurotypicals even. But for the PDA person, that's just fantastic.
Having a little bit more preparation gives you more freedom. And the same with even you said up to like dating, like the preparation of, hey, let's go to the movie. You're organizing, you're setting plans, you're preparing for the date so that while it's happening, it's a little bit easier on you. Same with setting the rules, the boundaries, guidelines, safe words, things. You're setting all that up ahead of time, but that gives you a little bit more freedom.
Let's talk about the setup is really important here, right? You know, if you're into kinky dating, whatever, the app that you might use or the channel that you might use might already kind of specify what kind of fetishes you like and which ones you don't.
Right.
So it's really cool to have that stated beforehand and make sure everybody understands what everybody's personal limits are. And this is kind of obvious for the kinky fetish dating, right?
Right.
So this is a really, really safe space for a PDA.
Even apps that aren't necessarily targeted to that, but still targeted to dating and more sexual relationships outside of the kink community still have those options for like tags or keywords that people put up, usually with those kind of things inside of it. Yeah.
It's kind of a tacit agreement. Everybody understands what the other's expectations are. And as I've said before, but this is a really important point, being predictable beats being nice every time. That's just really important. So we've at different times talked about corrective experiences and all and how that works. So if you're anticipating something to happen that might hurt you, feel rejected or criticized, whatever, and you go through a really good structured sexual encounter, that might be your chance of having a sexual encounter. For obviously make sure you're safe and you
take the precautions.
Exactly. But that might be a wonderful way for you to get in touch with something that might end up not needing roleplay again later. So you know how we discussed the corrective experience, right? And having a corrective experience through a really structured environment is probably a really good way to use roleplay to get you habituated to a situation that you would normally not put yourself into. So this might be a chance that you have to live different sexual experiences through an initial, considering all the safety concerns and all, but through an initial encounter that's really structured. And now, if you're doing this in a neurodiversity affirmative world, that's going to be really easy. But let's say you have to have an accommodation or a really structured start at a company that you want to start working at. But there is a generational divide between you and the management. and they will not accommodate. And that makes it really hard because older generations tend to not be very neurodiversity affirmative.
We definitely see a difference in how generations portray what may or may not be PDA. We don't know with older generations because a lot of them, they're never going to go find out. Millennials did start going more to psychiatrists, to therapy, and even going newer, even younger generations, mental health is still growing and becoming more and more important. What do you think about the younger generation, where a lot of them may not even be diagnosed, but they relate to PDA more, and
there's much more of an openness and a possibility of having PDA right now. So the illustration that comes to mind for me is if you see how the older generations dealt with a kid that falls on the ground and hits his whatever knee, and the older generation might really just respond, "Walk it off, buddy. Nothing to see here. No, you're fine.
rub dirt in it."
Right? Yeah, exactly. If it hurts, it means you're getting stronger. What doesn't kill you, yeah, whatever. And there is the underlying idea that if you suggest hard enough that your kid is fine or that person is fine, they'll eventually believe it. And they probably have gone through that same kind of education, obviously, or still. And you just have to push through it, and you have to ignore what you're feeling. You're just wrong. And if you're afraid, just do it while being afraid. And to me, also, the millennials are the ones that started accepting that, yeah, it might hurt. And it's okay if it hurts. And maybe millennials are the ones that are pushing that too far and on the other side of the spectrum. And maybe there is an equilibrium, sweet spot somewhere in between the two of those. The fact that we now start to see PDA doesn't mean PDA wasn't around earlier. When all the generations say that, we were much healthier. Nobody had depression. Nobody had anxiety. You just called it life.
Yeah, no, you lived in the Great Depression. Your entire life was depression.
Right. I feel like there's just so many biases there, but the one that occurs to me all the time is the survivor bias. You have no idea what you're talking about because you're just seeing the survivors, the ones that did not manage to push through, the ones that did not manage to just believe their pain wasn't real. Those are dead or in a psych ward. Or
I think that that idea fits really well with veterans.
Right.
You can, if you see a veteran parade, those are the people that survived, and not just talking the war. They're the people that survived the mental health aspect afterwards. So you see the people that handled it were healthy enough to get by, but you don't see everyone else that wasn't.
Yeah, that is very obvious bias because there's so many confounders in there. And just saying, yeah, that person is well and survived and doesn't have PTSD because he's really strong because his dad suggested that he didn't see shit, whatever.
Right.
Right. And that's obviously not true. You don't even see the suffering that's going on, and you don't know if that's the reason he survived either way. So, but there is a really strong feeling online that what PDAers do is just a lack of willpower, or just slacking off, or just whatever, faking your way through life and not being a good person.
Excuses.
Say it again.
Excuses, yeah.
Just choosing to be a bum just because you're incapable, because your parents didn't socialize you enough, or because they didn't hit you hard enough. But it's really hard. We have to understand that there is no way that you can actually punish someone out of a panic response. You're just gonna make it worse. There's no way on earth that you can just suggest that the pain that a PDA is feeling is not true. It's not true for any psychiatric disorder, not true for any suffering whatsoever. You don't compare suffering. You are not that person. You don't know about their genes. Cool, awesome. You're 75 and you've run 50 marathons and climbed Mount Kilimanjaro without oxygen and whatever help, and barefoot and while shaving yourself all the way up. That doesn't mean shit about the other person.
You made a point about panic response again. So PDA being a panic response, I just want to clarify when we say panic response too, it's not someone's going to throw everything in the air and run around and go crazy. Panic response can be freezing or just not being able to continue their task.
Case of the PDA, the most likely is freezing, which is the best panic response. In a world where being different or showing emotions or masking is the norm, it's going to be really hard for you even to show up. So people are going to rather avoid interacting at all than trying. So there's one approach that's called the alleycat approach. Maybe a strange way of putting this, but I still truly believe that the alleycat approach should be the ideal approach for anyone, everywhere, anytime, really, no matter what generation, what neurodiversity or typicalness, whatever. So you have to understand that the alleycat in the dark alley you're in needs time, and it might choose not to approach you, and that's cool. And that's perfect. You don't have to. Take your time. If you want to talk to me, if you need help, if I can help, if you're ready for that, you can just tell them, you can show them. You don't need to look at me. We don't need we don't need eye contact.
Sure. Take your time, be careful.
Exactly. There's no need whatsoever for you to step in here masking and not connecting. You don't have to do that. That's the ideal. But somehow to all the generations, there's still the idea that everybody should mask and everybody just should pretend to be neurotypical. And I do strongly believe that this is not what the world needs. Diversity, to me, has always been enriching, and neurodiversity is very, very, very enriching. If you're taking that person out of society because you're demanding that person appear neurotypical, you're taking so much away from what that person might contribute to society, what that person might contribute to art, what that person might contribute to social life whatsoever. There's no way I cannot wrap my head around this, how someone could believe that this should be the ideal. I feel like we should all try to be more neurodiversity affirmative, and I'm not saying that I am. I try to. I aim to be neurodiversity affirmative. And so going back to the alleycat approach, if you're giving that person the time, and you should basically just state that at the beginning. You don't. Psychiatry is very much an alleycat approach, anyways. So many people come here with all their shields up, and they're not. How should they know that I'm an ally? How would they know if I can accept their issue? How would they know whether or not I feel like that's an issue or that's psychiatric and that needs medication, but it's actually a core value to them?
Sure.
So we really like to take things slowly, try to connect somewhere and show them that it's okay and that we are an ally and we will not do anything without consent. And you don't have to reason about whether or not you are entitled to leave immediately. You're entitled to stay here. If you can handle it, you're invited to give directions. You don't have to talk verbally. You can send me messages. There's so many things you can do to accommodate for neurodiversity, and I really strongly believe that this enriches the world drastically.
Thank you for watching. Please subscribe and get notified when our next episode drops.